Thank you, Senator Van Hollen. Senator Smith.
Well, thank you so much, Chair Warren, and thank you to all of you for being here. As I think maybe you know, this is a subject that is near and dear to my heart, and I really appreciate the questions and the comments of my colleague, Senator Van Hollen, as well, because everything that I have learned from doing this work and from talking to families and providers and local businesses in Minnesota is that this market, as you're saying, is broken. It does not function as it needs to function. There is, the business model doesn't work, is how the family providers, childcare providers that I talk to tell me. You know, and I was just recently in August visiting providers in rural Minnesota and in small town Minnesota, and I want to just highlight what impact the shortage of childcare and the lack of the affordability of childcare, what impact it has on rural communities as well. And this is a choice that we're making. We're choosing to do other things rather than fund a childcare system that works for Minnesota and American families. And I just think that's the wrong choice. And when people tell me that, you know, we can't afford to invest in childcare, I just don't understand that, because we know that the health of our babies is the number one thing that we should be paying attention to. And I'm going to come to you, Mr. Hopkins, because I'm really curious to hear about your experience as we put more money into childcare during the pandemic. And we had childcare relief funds that were designed to help boost compensation for providers, to help sort of strengthen and stabilize the business model for providers, and at the same time to try to make it more affordable for parents. And so could you just tell us a little bit about how that worked for you in your at Hopkins House, and how you use those stabilization grants, and what is the impact now that we're seeing that support go away?
Let me start with letting you know that at my center, for example, it's $20,000 a year for infant care. That's just one child. If you've got two or three, it's $60,000, $70,000, unaffordable.
I'm a grandmother of several toddlers, and so I hear about this all the time. I appreciate that.
And this is important in all of our work in understanding how much childcare costs. And even there, at our center, which is a nonprofit organization, we're subsidizing even that rate. That doesn't even come near the true cost of quality childcare, which is closer to $30,000 per child. And so I want to get that out there. How we use the money, we increase compensation. To give you just one example, at our institution, we were paying, prior to the pandemic, $35,000 a year to a teacher with a 4-year degree in early childhood. All right? Now, through these funds, we're now paying a minimum of $45,000. But let me suggest that number is still not high enough, because you can become a kindergarten teacher in the city of Alexandria and make $56,000 with the same credentials. Childcare is not well funded. We also found out very quickly these are moms who work for us who themselves didn't have health care.
Right.
They were using hospitals and emergency rooms as a place for their children to get care. So now, using the funds through the ARPA funds, we now provide free health care to all of our employees who need it. That's enormous. That's a big thing. And without the funds we're getting from the federal government, I'm not sure that's going to survive past this pandemic. We also made sure we took care of all of our staff. We've got employees who've been working for 10 years or more at Hopkins House. The notion of putting those people out in the streets because we have to lay them off because we can't afford it, I can't even begin to imagine. It's the sort of thing that keeps me awake at night, and God, I do need my sleep. And it's troublesome. And I'll finish up on the rural side of things. You know, Virginia has a number of rural communities, and those communities need to be served as well. And the kind of investments the government is making in incentivizing businesses to put internet access in rural communities, why not also incentivize businesses to put childcare, quality childcare, in those very same communities that you have in Minnesota?
Absolutely. And you think about a network of childcare providers that could include Head Start and family child care providers and small centers in rural areas. That is as much a part of the economic infrastructure and the healthcare infrastructure as broadband, I would argue. And we don't expect those families in those communities to pay the full freight of third grade And so why, though, are we expecting them to pay the full freight for, for their infant or their toddler? This is something that I've heard, I've learned from Senator Warren, who is such a strong advocate for this. So thank you very much for you all being here and for this testimony. And I hope that this will help to draw attention to this very important need. Thank you, Senator Warner.